Thank you so much, Divya, for the introduction. I welcome everybody for today's session. I hope we have a good interactive session. So let's start with today's session. So today we'll be talking on the nutritional challenges in a senior population, and today we'll be also looking at the various nutritional needs that change with age. The key components of the key nutrients that we should be focusing. As we age, the various nutritional challenges that is faced once we age, the various underlying factors, and certain practical solutions so that we ensure better health outcomes and better quality of life. So before we go into the session, let's start with the icebreaker question. I would want to know from our audience as to what is your favorite meal of the day and why.
Yeah, madam, can you hear me?
Yes, sir. Hello, sir. How
Hello.
are you doing, sir?
I'm good. Madam, I'm calling from Calcutta. My name is Sarukundu Chakraborty, as you can see. I am
Right,
64 plus, but
right,
physically I'm close to 50 in terms of my
right,
mind and all, right?
right.
I'm a yoga practitioner and I take care of
Oh,
my diets very strictly.
right.
In the so to say, just to suggest that my mother used to tell that in Bengali I'm telling, एक जोगी दुई भोगी तीन रोगी मतलब once you one time if you take you are a yogi, two times if you take भोगी मतलब you can understand, तीन टाइम मतलब
Right.
हो गया मतलब पेशेंट, और चार टाइम कहा का मतलब हो गया गृह मतलब आप डोमेस्टिक एनिमल है, ठीक है. So I have gone
हाँ,
for this
हाँ,
two times food habit, and for
अच्छा.
about last 1.5 years to 2 years, and to the higher side, I am used to my recipe which I made for myself, courtesy YouTube and some books here and there. I make a
Okay.
mixture of carrot, beetroot,
Hmm.
flaxseed, and
हाँ.
kala jeera, and
Hmm.
white tea, then about 50 grams of chana ka sattu, and about
अच्छा.
100 grams of homemade curd. I
Hmm.
make a
Hmm.
mixture
Hmm.
of, and that is something we can make. I make a paste of it and I gulp in.
Hmm.
And believe me, I don't know
Very good.
whether you at all come across such a such a recipe at all. This is something which takes care of my all nutritional things. So at least so far my understanding goes, I don't feel hungry.
Yes.
I don't feel any lack of energy, anything of that sort. And
Right.
in fact, I'm used to it basically. But again,
Right.
to be on the safe side, since I've got 8 family doctors in my immediate family, I'm told that at regular intervals you have to take something or the other, so that the stomach
Yes.
is never empty. And before
Hmm.
sunset, I go for very small quantity of maybe one handful of rice and some dal and some little quantity of vegetables in whatever I want
Right.
to make a sort of rainbow color, as many color as possible. And the day I take dal, that day I don't take any fish and all. Of course, mutton is out of question. Chicken maybe once in a month or twice, max to max. And this is something, this recipe I'm following for about last 2 years. I walk about 3 to 4
Okay.
2 to 4 kilometers per day. My BMI is 22. My weight is 73, and my age is 64. As per survey, but I'm fit as 60 years. Tell me if I'm wrong.
Right. It's a very good thing, sir. We all should learn from you. Whatever you are doing is perfectly fine.
Oh, wow. This is something the biggest compliment so far I've got from anybody, because whoever I have shared my food habits with, everybody has laughed at me and they have told that why don't you go to Himalayas and all. And all sort of, I've made myself a laughing stock basically. But irrespective of that fact, this is something which I'm practicing.
This is very important thing. We should all
You've been doing
learn. Yeah.
really.
So, madam, since
At
you are
this
a
age, at
professional
least,
in this
yes.
line, if you can just suggest me whether I'm following the right path or something I need to add or something. I need to change my food pattern
No,
or
no, sir.
habit,
Your
whatever.
diet is completely fine. The recipe that you are talking about is quite wholesome. It has everything, pulses, fruit, vegetables, seeds, everything. It's antioxidant rich, it's vitamin and mineral rich. So that's what, when you take that, you do not feel hungry. That's the reason that, when you take that recipe which you make, you do not feel hungry. So it's a very good thing. It's good that you are also learning, and that's what, makes you look forward and you feel like having food when you uh, get engaged into the process of cooking. So it's a good thing, sir.
Okay, thank you so very much. In fact, your endorsement is it means a lot for me because I was wondering whether I'm in the right path or I'm not. So I was slightly wondering. But in any case, thank you so very much for your words.
No problem, sir. No problem. Anybody else? You can also put it in the chat.
You're talking about me?
I No, 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 no. Anybody else, if you would want to let me know what is the favorite meal of the day and why?
Sorry, come again, Nirupama.
Sorry, sorry, sir.
Nanu Satpati here. What was your question?
I wanted to know from everybody what is your favorite meal of the day and why.
Okay. My favorite meal of the day is my breakfast.
Right.
I make my own tea and I make idlis. Some days idlis, some days dosa, some days um, what do you call that? With suji, you make that upma with a lot of vegetables in that. And
Right.
I'm 74 years old and I'm a widower. I live alone. I've got a servant whom I have trained to make different breakfast every day.
Oh, that's a good thing. It's
And
good to know that you have trained him to to make breakfast for
yeah,
you.
when he came to me about uh, 16 months before, he told me that he used to work for a senior person and he would just do the jhadu pocha. I told him, beta, and he is about 18 years old now. So I told him, beta, मैं अकेला रहता हूँ, and it's jhadu pocha is not exactly what I'm looking at. I want you to take charge. So every time and incidentally, I started my passion on cooking when I was 70. So
Oh,
I taught him all the dishes that I know how to make. He can make lovely chicken, mutton, and egg curries and fish and everything. I'm a non-vegetarian. So,
that's a good thing.
and I was listening to sir who was speaking before me. So it's I it's all healthy food. I don't eat all those healthy food. I uh, just hope and wish that he lasts forever.
So he is a yoga practitioner.
Ji.
It's okay to
खाते रहो,
indulge
मस्त
in
रहो. And I know you are a specialist. You would uh, tell us what we should eat. I eat whatever I feel like because this is just one life.
that's a
I
good
don't
thing, sir.
even know whether I'll be born as a human being all over again or not. I have no clue.
मस्त वाली लाइफ जी रहे सर.
Acha, one question,
That
Nirupama. I used to work.
definitely.
I worked in Northeast. You are a Mahanta by birth, or you are a Mahanta by marriage? Are you from
By birth.
Assam?
I'm from Orissa. I'm from Orissa.
You're from Odisha.
I'm Orissa, yes.
Oh, Odisha, do we have We have Mahantis there.
We have Mahanta also in the western part.
Okay, okay. My bad. I didn't know that. I'm from
No
Odisha too.
problem, no problem.
I'm from
Oh, okay,
Odisha too.
which place, sir?
Why?
Okay, that's
I'm
good to know. Which place,
Satpathy.
sir?
My parental place is Dhenkanal, but
Acha.
I was born and brought up in Cuttack.
Okay, okay, okay. So you're still there in Cuttack, sir?
No, I'm in Gurgaon now.
Acha.
I have come a long way all over the world and back here.
Good to know. Good to know. It was nice talking to you, sir.
ମୁଁ ଆଜ୍ଞା
Thank you.
ଓଡ଼ିଶାରେ 4 ବର୍ଷର ଖଣ୍ଡେ ମୁଁ ଥିଲି ମୁଁ।
Sorry, I took you away from your topic.
No
My
problem.
mistake.
No problem. No problem. It's always good to interact with, to people to know so that we know each other and others will also know, get to know us and learn something from us. So no problem, sir. Sure.
Thank you. Thank
Well,
you.
sure. So we'll start with today's session.
Sure.
Sure. So aging can be again, defined as the various collective changes in various physiological, as in psychological and lifestyle factors over a period of time, which results in again progression of deterioration in our functioning, increased susceptibility to a disease, and also decreases our viability. So as we age, our nutritional needs also change significantly, and it is very important that we address these needs on time, which will help us for a healthy aging, for a better quality of life, and for a better independence. Therefore, health education and promoting health is very important. It plays a very important role in maintaining good health, good immunity, good mobility, and independent functional status as we age. So now, next, let's look at the age-related changes which basically impact our nutrition as we age. The first and the foremost are the physiological changes. So physiological changes basically includes the changes that happens to a normal state of our body. For example, there's reduced metabolic rate. So as we age, we see that there's weight gain. We are unable to reduce weight drastically. There's unwanted weight gain. There's again a lot of other conditions cropping in, for example, your diabetes and other chronic conditions. There's insulin resistance and all of those, which again puts it at a risk of malnutrition. The next is sarcopenia, which is basically this reduction in the muscle mass and increase in the fat percentage. This again, happens because of low protein or eating foods which are low in protein. So it's very important that we meet up a protein requirement. So a person might appear normal and might have a normal BMI and normal weight, but that doesn't mean that the person is not sarcopenic. So it's very important to have good muscle mass. The next is lower gastrointestinal function. So as we age, again, we end up with conditions like bloating, constipation, there's delayed gastric emptying. There's decreased production of stomach acids, which again leads to malabsorption of certain nutrients. For example, your vitamin B12, your calcium, iron. There's also decreased in digestive enzymes, which may result in poor digestion, poor absorption of fats and vitamins. So it's very important that we take care of our nutrition. We address all these needs so that it ensures for a better quality of life. You would have observed that certain food items which you would be tolerating or you were enjoying say 20 years back, you wouldn't be able to, for example, say you able to enjoy it now. It's because of all the physiological changes that have happened in your body. So we're always supposed to modify our diet and all those things accordingly to ensure that our nutrition status is maintained. The next is sensory decline. So there's loss of taste, smell, there's dental and chewing difficulties again. Due to it could be again due to certain medications that you are taking over a longer period of time, which affects your taste buds, due to which there's decreased taste and smell. You may also experience dry mouth during old age, which reduces the ability to chew or swallow comfortably. There are again all other psychological factors as well, for example, say lonely, depression, and reduced appetite. So it's very important that we address all these needs on time to ensure we get proper nutrition. Because if we do not have a good nutrition, if we do not meet a nutritional requirement, it again affects other things. So next, let's talk about swallowing and chewing difficulties in detail, as this is one of the major reason for which the nutrition is compromised, affecting about 40% of the individuals as we age. Again, there are various causes to it. The first is, of course, age-related, resulting in decreased muscle mass, there's decreased strength and coordination, there's lower reflexes, there's changes in oral cavity and throat muscles. Next, it could be also due to certain neurological conditions such as stroke, Parkinson's, Alzheimer's, dementia, which impairs the motor control required for swallowing and chewing. Next is dental issues. Again, due to missing teeth, there's ill-fitting dentures, there's gum disease, which can complicate chewing, and it could be also due to certain medications. Because as we age, as I said, we develop a lot of chronic conditions, which requires to take a lot of medications on a regular basis, which can again affect the oral intake. The next, talking about the symptoms, the first and the foremost symptom that we usually, see when there is any difficulty in eating is frequent choking or coughing while eating. There's also difficulty in swallowing solids or liquids. There's difficulty in controlling saliva. There's frequent drooling, or there's frequent respiratory infections or pneumonia. So all these factors basically predisposes to malnutrition, sometimes often leading to isolation due to difficulty in eating in social settings. Next, coming to the management of such conditions. So in this slide, we'll be talking in detail as to how we can manage the chewing and swallowing difficulties in our seniors. The first and the foremost is speech therapy, because it's a great way to strengthen your muscle in your throat and mouth and improve care. It's very important that we take care of our dentures, dental implants, and improve the chewing ability. It's also very important that we maintain hygiene in terms of brushing our teeth and things like those, to ensure that you are able to eat well. And the third most important factor is diet modification, which can be done by modifying the texture of the food into something like soft, pureed, or thick consistency instead of thin, to reduce the risk of aspiration or choking. The next is encouraging thicker liquids instead of thin liquids. We have to ensure small and frequent meals. We should make sure that there are not very long gaps in between the meals, because I understand, for some of us as we age, we do not feel like having a lot of food. We do not feel like having too much at once. So it's important that we break our meals and have something which is nutrient dense. The next is nutritional adequacy. That means meeting the nutritional requirements with adequate food intake, and if required, supplementing it with some kind of oral nutrition supplements. The next is by adding moisture to the form in the form of gravies, or so that it doesn't stick or it is not very dry or hard for you to swallow. The next is considering the temperature while having the food. It is very important to have food proper temperature. For example, if you're having soup, it is important to have it hot, and if you're having something like custard or something like some kind of pudding, it is important that you have it in cold temperature. Because temperature will help for better temperature considerations, will help to better production of saliva, and will help for better withstand for having the food.
I have a
Next,
question.
again,
I have a question.
tell me please.
There are we have cold soups and we have hot soups. Uh, so how does one choose between the two? Like
Again, it depends on what you like, but most preferably, I mean, depending on what you are used to. If you're used to having cold soups, or if you're more fond of cold soups, you can have. But most of us, I believe, are more fond of hot soups. So yeah, anything what you like, sir. But preferably, anything that is served hot, that is to be served hot is to be served hot, and something to be served
Okay.
cold is to be served cold.
Okay. Sorry for the interruption. Carry on, please.
No problem. No problem. And we must also ensure that the individual is seated upright, say about 90-degree during and after the meals, to reduce the risk of aspiration. And while feeding, it is also very important to closely monitor any symptoms of choking, or monitor for any risk of aspiration. The next is hydration, which is very important, because as we age, our perception of thirst decreases. We forget to drink frequently water. So it's important that we set reminders for ourselves and drink water. That's very important, because most of us, as we age, we end up having a lot of issues due to less water intake. For example, you will have UTI, dehydration, gastritis, and not taking enough water is one of the major reasons because of which you end up having all these issues. Unless you are having any condition in terms of heart or kidney which requires you to take less water, please ensure take enough water throughout the day. Again, lastly, we must monitor and adjust our meals as per our requirement and as per our tolerance. So it's very important that we closely monitor our food to ensure that our nutritional status is maintained. So next we'll be looking into a video as to whatever points I told, how we can manage with the person having difficulty in chewing or swallowing difficulty. So this is just a video for you to have a better understanding.
The following are suggested safe feeding strategies for persons with swallowing impairments. For specific strategies, please speak with your speech therapist. Ensure the person being fed is seated upright and is not leaning back or to one side. Check that there is adequate support so they do not slide down. They must be alert with eyes open or able to respond to conversation. Do not feed a drowsy person. It is recommended to sit next to a person when feeding them instead of standing. This is because they may tilt their head to look up at you when eating or drinking, which may lead to coughing or choking. Feed slowly, following a pace that is comfortable for them. Check to make sure they swallow each mouthful before giving the next spoonful. Avoid overloading the spoon, as this may be difficult to manage. Stop feeding when they refuse or indicate that they are full, even if they have not finished a full share. Do not force feed, as this may lead to negative feelings around meal times. Reduce distractions during meal times, including talking, as they may choke or cough when they are distracted. Monitor if they are coughing or appear to be choking when eating and drinking, as this may indicate signs of difficulty swallowing the food and drink being served. If coughing is observed, stop feeding immediately and allow the person to finish coughing and rest.
পিছিয়ে তো মুছে দিলি না সাজান চুপ করে খালি বসে
Please contact your speech therapist if you have any questions or concerns.
So now let's look at the nutritional challenges. What are the various challenges in terms of nutrition that we face? The first is macro and micronutrient deficiencies. This is again because of lack of poor oral intake, or not eating much, or not eating on time and things like those. So include flavor boosters in your meals, which will basically improve your appetite and help you to eat well. Certain things like herbs, spices, things like jeera, hing, ginger, coriander, mint, lemon, and all those things can be added to your diet, which will help to, improve the flavor of the meal. Also, you can include certain natural appetite stimulators, such as your ajwain or jeera tea before meals, which will help you to eat well. The next is dehydration, which is again due to lack of water intake, as I mentioned. So it's very important to set reminders for yourself and drink adequate water. And both of these again predisposes to malnutrition, which is again a major concern as we age. So next we would be discussing about the common nutrient deficiencies that we usually see as we age. Okay, so what do you think would be the major deficiencies that uh, might be there as we age?
Beg your pardon, could you just come again?
I would like to know from our audience, what do you think are the major nutrient deficiencies that could be seen as we age?
Uh, I am uh, finding that I am not feeling as thirsty I used to feel earlier. I have to remind myself to drink water
Right. That's
Mm,
true, sir,
because
because as we age,
Doctor,
yeah.
if you allow me to butt in, I think that I don't know whether it will be part of the nutrient or all. Decalciumation is one of the things which probably we miss out during in the process of our taking foods. Calcium content, is it a part of the nutrient?
Yes,
Am I right?
yes, yes, you are right, sir.
Okay, thank you.
I don't know whether it is
Sure.
calcium,
So
magnesium, or
now
potassium,
let's look at
but
the common nutrient deficiencies that we end up getting as we age. The first is vitamin D, of course. And vitamin D is also common now in youngsters also, because we do not go out much. We our job is mostly inside, so we tend to have a lot of vitamin D deficiency. So it's important. Fruits are again very poor sources of vitamin D, so it's difficult to get vitamin D from your food. Ensure that you are on a maintenance dose and keep your vitamin D at check on a regular basis, because that affects your metabolism to a greater extent. So it's very important that your vitamin D levels are maintained. The next is calcium, as Sir said. It's important for both bone health as well as your other teeth and things like those, hair, nails. So it's
90
important
na
that you uh, maintain your calcium intake in your food. However,
Ma'am,
the absorption of tell me please.
ma'am, Bayana sir, have one doubt, ma'am. Is there any specified
Tell me
duration for
please.
which one should be in 90 degrees position post eating meals? Sir mentioned
Sorry.
in the comment, ma'am. Sir asking question, ma'am, like this. Is there
Ah,
any specified duration for which one should be in 90 degrees position post eating meals?
about 20 minutes, 15 to 20 minutes should be enough. If you can sit for 30 minutes, it's always a better option.
Okay, thank you.
Thank you. Anything else? Anything else?
Doctor, I've got another question. Uh,
Tell me please.
what are the foods or rather items in which we can get vitamin B12, and how do you know that I'm lacking vitamin B12? How do I know? What are the symptoms?
Vitamin B12, sir. You'll
Yeah.
end up having a lot of fatigue. You do not feel like doing your regular activities. There's significant anemia that you can see that it is. So these are certain things that will tell you that your vitamin B12 is low. You might also sometimes have difficulty in digesting certain foods. So you will have a lot of issues with digestion. You might have a lot of frequent gastritis and things like those, which you that you are vitamin B12 deficient. But again, there are other tests to be done to confirm that you are deficient in vitamin B12, and doctor will be the best person to tell you as to what test to do. But these are certain symptoms that you can see. And vitamin B12 is again rich in all the non-veg sources, so it's important. If you are a non-vegetarian, please have on a you better absorption. So include vitamin C rich food on a regular basis in the form of say lemon or some guava, amla, and all those things on regular basis, which helps to increases the absorption of vitamin B12 as well as iron. And certain foods which are uh, good in terms of calcium would be your milk and milk products, your greens, certain greens, for example, your drumstick leaves, your methi leaves, your amaranth leaves, your seeds, for example, your sesame seeds, ragi, bajra, flax seeds, chia seeds. All of these are a very good source of calcium. Even your dried figs have certain moderate amount of calcium in them, but make sure that you limit salt, caffeine, and all those things in your diet for better absorption. Sure. And then, sure, sir. Any other questions?
Doctor, I have got another question. I'm sorry that
Tell me,
I'm
please, sir.
disturbing you time and again.
No problem.
I'm not a doctor, but whatever I'm limited to that extent of YouTube. My knowledge is confined to that only. So I'm told, in fact, through YouTube, I have developed this idea. I don't know whether it is right or wrong. That is, collagen is the component in the skin which deficiency of which ultimately can cause that our skin slackens, and
Yes.
there are basically the skin is not toned up properly because of the deficiency of the collagen.
Yes.
So if you can just throw some light on that collagen, what is the contents? What are the items that contain collagen? How do
In
I
food, sir?
in food, of course.
Yeah. Sure. Basically, collagen is again not a very, foods are not a very good source of collagen, but yes, certain seeds are very good source. So you can stick to, sesame seeds, pumpkin seeds, chia seeds, and all those things. So 1 teaspoon per day, a mix of all the seeds would be good enough to maintain your levels.
Okay, thank you.
The next deficiency that one might end up with is protein deficiency. Because of course, because lack of not eating well and not knowing what is good. So that's again the major deficiencies. And apart from all these, another is drinking adequate water throughout the day, which is very important as we age. Next, coming to the consequences of poor nutrition, it definitely affects our health, increases the risk of infections. There's more chances of falls, fractures, there's delayed recovery from any kind of illness or surgeries. There decrease in cognitive function. There's cognitive impairments, there's confusion, there's memory loss, and things like those due to poor nutrition. And there's also increased or frequent hospitalization due to these deficiencies. Uh, so it's very important that we take care of your nutrition so that we do not end up having all these issues. Next, let's look at certain practical, points for improving the nutrition as we age. The first and foremost is having a balanced diet. It's okay to have your favorite meals or favorite food in a day, but ensure it's a balanced plate, it's a balanced meal so that you are not devoid of any nutrition. The second is modifying the meal as per your requirement, as per your tolerance. So if you are not able to eat certain kind of food, modify the texture of the food so that you are tolerating it well or eating well. Next is
Hello.
maintaining small and frequent meals. Yes, sir. So you're wanting to say something?
I think he has just joined the group
Okay,
and
the group. Sure. No problem. The next is supplementing with any kind of deficiencies that you might end up with, if required, starting with the oral nutrition supplement to meet the requirement. Next is adequate hydration. And the last and the most important is addressing the medication. So it is very important to, talk to your doctor or your healthcare provider to review your medication and know if that might interfere with any of the nutrient absorption or might interfere with the appetite, so that accordingly your meals or food is modified so that you do not compromise on your nutrition. Now, the next important thing as to how we can, improve the nutrition of our seniors is by encouraging social interaction. We should make sure at least, we are having one meal or share meals with our family, with our relatives, with our friends, which can improve our appetite. It again reduces loneliness. We get to learn from each other. You get to know each other, and that has a very good effect, or improves your food intake to a greater extent. So it's important that we always share our meals. Make sure that you do not eat alone. Next is by engaging in meal preparation, with grocery shopping, with planning preparation, especially those who are having difficulty in cognitive impairments. For example, you're having memory loss or you're having difficulty remembering things. So start engaging in all these activities that help to improve your cognitive function as well. Also, it is very much important that we monitor the nutritional status frequently, monitor the weight, any changes in your diet, everything on a regular basis to make sure that so the major takeaways from today's session is that we independence and quality of life. It is important to do proper interventions, including certain dietary adjustments, supplements, and prevent any kind of malnutrition related health issues in future. That's all from my side.
first I said that all of us must collectively give you a big hand for being the senior most in this group, being 84.
Right.
दूसरी चीज है कि मैं अभी तारकेंदु को बोल रहा था कि मैं तेरे से 10 साल बड़ा हूं. He is 64, I'm 74.
And
And
I'm
my salute to you, you are 84. You are a
I'm
decade
80.
older than me. So
That's right.
I was just mentioning it to Nirupama that whatever sir is doing, Bansal sir is doing, is wonderful. You
Yeah.
know, this is the best way to live your life. You are perfectly in control of yourself, your food, your exercise, your walking. I think it's just wonderful. Keep on doing whatever you're doing, sir.
So
This is
nice of you.
wonderful.
Really nice talking to you. And I think we'll have more meaningful conversations.
Sure.
Yes, welcome.
Surely we'll catch up.
Anybody else has got any questions for Nirupama? Because I guess we are running out of time. Maybe you got 10 more minutes for us. Any questions? Bayana sir, you've got any question for Nirupama?
वो एक क्वेश्चन था वो पूछ लिया, उसका जवाब मिल गया.
अच्छा.
मैडम ने बोला कि वर्टिकल बैठ के खाना खाना चाहिए, वो तो ठीक है, समझ में आ गया. मेरा क्वेश्चन ये था कि खाना खाने के बाद कितनी देर हमें वर्टिकल बैठना चाहिए, तो उन्होंने कहा 20 से 30 मिनट.
ओके.
तो दैट्स ए गुड इनपुट. और आपने जो स्टैंडर्ड डेफिशिएंसीज की बात की, तो दैट टाइम आई वाज raising my hand thinking that you will invite me to speak, but anyway, you came up with the
So
slides
sorry, sir.
almost saying the same
I'm
thing.
so sorry.
No problem. my experience of last maybe 10-12 years says that most of us are deficient in vitamin A and vitamin D and B12. So for vitamin D and vitamin B12 तो since I am pure vegetarian तो मुझे medicine लेना ही पड़ता है. I don't have any other answer.
हाँ,
But vitamin D के लिए, apart from taking the tablet, I have practiced one method which has helped me a lot. Because of that, the medication comes to very minimal.
What is that?
While taking the milk from the shop, I choose the option which has vitamin A and D added. So small quantity of vitamin D is coming through milk in my body every day, so it compensates for daily usage by my body. So that has helped me a lot. So I thought I'll share with the group.
Great, great.
it's a good
Doctor,
it's a good input, sir.
तो बहुत ही बढ़िया है. You are lucky here. I cannot drink milk because I am lactose intolerant. So vitamin added or not added.
Sir, there are other products. There are other products where vitamin A and D is added.
Okay.
So I will chat with you over phone to tell you what are those ideas.
मैंने अभी चेक कराना है कि कौन से विटामिन कमी है मेरे में.
डॉक्टर एक बात और मुझे पूछना था.
एम की तो कमी है ही है.
बोलिए सर.
मुझे एक चीज़ और पूछना था कि जैसे कि यूट्यूब में अगेन मेरा नॉलेज यूट्यूब से है. इज इट सो दैट एक्सपोजर टू द सन रेज also contribute vitamin D in the human body? Is it so? Exposure to the sun rays. Hello, can you hear me?
Can you please come closer to the mic because
sun rays before 10 o'clock in the morning.
आपका वॉइस ब्रेक हो रहा है, फिर से बोलेंगे.
Nirupama ji, sun rays before 10 o'clock in the morning. That will help a lot in vitamin D.
That is something I just wanted to get confirmed.
Yes.
That is something which I wanted to get confirmed.
Yeah,
that is something
10 o'clock. 10 o'clock in the morning. Otherwise, it will become cancerous.
Okay.
As far as I know.
Okay.
Am I right, doctor?
About 10-15 minutes in the sun.
रजनी कैंसरस है कि नहीं मुझे नहीं पता है. But after 10 o'clock, if you go out in the sun, you will get sunburned and you will feel very hot.
Right, ma'am. You're right.
तो हाँ, फिर नीचे आके एसी चला के बैठना पड़ेगा.
That's very true. Anuji, that's very true.
I guess is she online?
Kalyani always join, but she doesn't say a single word.
Okay.
Anyone else has any other questions for Nirupama?
No, I guess from my side it is over.
It's over.
Okay. Thank you, Nirupama. Thank you so much for such an engaging.
Thank you, ma'am. Thank you so much.
Thank you, sir. No
You are
problem.
very elucidating.
Thank you, everybody. Thank you.
Thank you
very
for
much.
taking out so much time for us from your busy
No
life.
problem. Thank you.